ADHD is interesting. There was a massive study called the MTA trial 20 years ago where they looked at 580 kids with ADHD, and they were really trying to look at how did medication compare to a really very, very good intervention involving parents doing a lot of parent behaviour management work, children getting access to social skills on a holiday camp for 6 weeks, 2 weekly teacher consultation, 50 days of teacher aid over a year for the kids. So a really good psychosocial approach. And that really, the results of that study showed that the medication approach and the medication combined with the psychosocial approach were much better than just the psychosocial approach for ADHD symptoms themselves. And that really changed how we prescribe for ADHD. So back when I qualified, there were very few people taking ADHD medicines. And we would encourage parents to go through quite a lot of parent management work before trialling medicine. And the MTA trial turned that around really, where if people have very significant ADHD symptoms, we will use medication much earlier than we used to in the old days.
So it sounds like it's quite a pragmatic approach given the constraints around the funding of the mental health in New Zealand, and the research is backing it up anyway.
Yeah. The current situation is difficult. I mean, I think our wait list within our service is around 11 months, 12 months for people with non-acute injuries where risk is not a concern or there isn't psychosis or those sorts of things. And it's just very difficult. It puts a lot of pressure on the system, and resourcing is a massive issue.